Hello, CAM followers. It is with great excitement that I have the lovely Dr. Matt Brunke back again to talk to us about all the things that we can actually do for our osteoarthritic cases. And we're going to step away from talking about just pharmaceuticals and supplements, and we're going to expand your knowledge base about all the things that can be done, because sometimes it's very frustrating when people just think it's only a drug or only a supplement. So hopefully we're going to inspire you over the next half an hour to an hour. But before we start, I really do need to tell you guys about what is happening in September. So we do something called the Big Walk, and it is our way of raising money to keep going. We are completely self-funded, vet-led organization with overheads of coming on $5 to $6 grand a month now. So these events are really important for us to remain independent and make sure that we provide you with the information that you need. I'd like to say thank you to our sponsors. We've been really well supported this year, and it's not too late for you to come on board and support us further. So please head over to the CAM online shop and check out the Big Walk. I'm sure one of my CAM ambassadors will be able to put a link for us. And join. It's tenner. It's a tenner. It's a tenner. It's for 30 days of amazing information. Right, now, please meet Dr. Matt Brunke. Introduce yourself, dude, so people can what you say.
I mean, welcome, everybody. I think you probably have heard me or seen me before. It's a pleasure to be back with you, Hannah, here on CAM. You can tell by the accent that I'm on the other side, you know, us ungrateful colonials that live on this side of the pond. I'm a veterinary sports medicine and rehabilitation specialist just outside of Washington, D.C., here in the States.
And you're a director now.
I am. I'm medical director for our department. So Veterinary Surgical Centers Rehab is our hospital group. I'm also founding faculty for this CCAT program, which is now in conjunction with NC State, which is a brand new, fully up-to-date rehab certification for both dogs and cats.
Amazing.
We shouldn't forget about our cats. We have
Tell us a bit more about that, because you actually, it's so new. It's quite exciting. There's many people that follow us that start getting into the concept of bringing rehab into their career. So tell us about it.
So what we did, and it's a royal we, right? It's me, it's Denny Marcel and Little at UC Davis, David Levine at UT Chattanooga, and Debbie Taraka up in Connecticut, in that New England area, not this old England, the original
old England area.
But we looked at it going, look, we wanted the most modern, up-to-date information, the stuff that we keep pulling off of PubMed and Google Scholar and going, hey, this is how we can help patients more. This is what's out there. This is what we as a team are contributing to research. We wanted to take that and put that into an extremely practical, not bore you to death, not overwhelm you with too much knowledge, but feed in all those foundation pieces to help us all as veterinary professionals, veterinarians, vet nurses, technicians, rehabilitation practitioners, hydrotherapists, physios, to really have that knowledge base of what's the most current stuff, but also because none of us, well, not none of us, but a lot of us are not in academia, so we're in busy private practice. How do we do that in a very sensible way to keep everybody up to date? So
yeah, absolutely. That's a big thing, isn't it? Trying to keep it within, say, first opinion practice. Many of us, I'm a first opinion practitioner. Yeah. We have time limitations, we have financial limitations, we have physical, emotional capabilities to consider of our owners. So we've got to be able to be really adaptive detectives that can create plans that they're going to stick to. So this is a really exciting course.
Yeah, how can you find something in 15 minutes? And what we want to do with this too is basically every 3 to 4 years, we're going to update all the content again, because learning doesn't stop. But I was in first opinion practice for a decade, right? Like I went.
Were you?
We went short version. I grew up in New York City, but I went to Ross for vet school down the Caribbean, which is why I always have a good base tan and why there's always palm trees in my life, right?
Yeah. Yep.
But my first job out of practice was a mixed animal. I lived the James Herriot lifestyle.
Okay.
And I did C-sections on 8 different species my first 4 years out of school.
Wow.
Right? Did all the primary care, first opinion, be triple booked, and then went to small animal primary care for a decade before going back and doing my residency.
Oh, bloody hell. You're a lot older than I thought.
Thank you. Thank you.
That's okay.
I color the hair. That's what, no, I'm kidding. I don't. But I went and did all that. So I used to have those appointments where we're all in, like, you look, you have 15 minutes, you have 2 blocked cats waiting, and you've got something else and 3 vaccine appointments. How do you find the arthritis? We'll talk about that. That's one we should all talk about. Number 2 is, what the heck do we do about it?
Yeah.
Right. So think, like, if I've been in those trenches of, like, how do we get it across? So I think that's the thing we'll kind of focus on today, is just how do you find it quick?
Yes, let's do that. Let's start there. So today we're going to basically try to bring a rehab perspective to OA management into a real practical way, so that people don't categorize it and put it on the shelf and go, I don't know anything about it, I'm never going to introduce it, I'm going to just stick to my pharmaceuticals. So let's start with the utter beginning, finding it. I'm going to lead a little bit. We've got breed predispositions, we've got age categories, we've got the history, we've got the observations. Please take note of everything that's available to you. There's certain breeds that are more likely. There's certain age groups it's more likely to be well established. And we have the ability to listen to the history. We have the ability to watch them get out of the car, walk into the waiting room, get from a lay to a stand before they even come into the room. But now tell us more about how we diagnose it.
All right. And the thing is, so there's 2 points I always want to get across to everybody. Number 1, the most expensive piece of equipment in vet med is you and you and you. Okay. It's not an MRI machine or a hospital or an X-ray machine or things like that. It's your ability to see and understand and put things together. Okay. So that's number 1. Number 2 is, I mean, I don't leap tall buildings in a single bound. I don't fly around the earth. And I certainly don't have X-ray vision. So none of us have X-ray vision. So when we get to, like, we think it's arthritis, we need to make sure it's arthritis, because sometimes it's not. And that can be devastating and bad, because it can be cancer. It could be other things that we miss. So we don't want to misdiagnose. How do you find it? This is the easy part. We're going to do interactive. Hannah, you ready to play this one with me? We're gonna see if Hannah's elbows have arthritis. Everybody watch this ready right now. So she's gonna do this, right? And you're gonna feel your own elbow, and you're gonna put your thumb on your index finger on the point of your elbow, and your thumb and middle finger to either side.
Yeah.
See how my thumb and my middle finger are in concave areas? Hers are concave too. Good, right? That means there's not any fluid building up in that elbow, right? And then you're going to extend your elbow out all the way, and you're going to count to 5. 5, 4, 3. If it hurts, pull away. 2, 1. It doesn't. So it gets there all the way. Okay.
Can you just pause and say that again? Because this is really important. And I know a lot of vets feel really rushed about this. Now, if you're a dog that's a bit stoic and you're having your elbow extended, they're going to go, I can hold it, and say nothing. If you just hold it for a few more seconds, they go, I can't.
Do that, right? And so hold it in extension, just let it be there. But pet the dog, right? The dog lays down, do it on the floor. Does it extend all the way? And let's go back and check your elbow, Hannah, right? Does it flex all the way? Can you pat yourself on the back? Can you leave it here, right? You have a normal range of motion. Does it close just like a door? Right? So if it doesn't open and close all the way, if it stops here, right? And the dog shudders, right? Or there's tons of fluid, right? Because it's convex and not concave. You have your suspicions. You can compare it to the other side. The other thing is you can just feel, right? Take your fingers like little calipers and go from one end of the elbow to the other and compare it to the other side. And if they're not symmetrical, if you're asymmetrical, one joint's wider, that joint is more thick, that joint's more arthritic, most likely, right? It could be something else, but that's the simple step of how does it bend? What does it feel like? And it's easy to do on me, right? It's easy for me to do on a Great Dane, harder to do on a Chihuahua or a cat or a little corgi, of course, right? But just feel and be gentle, right? And sometimes even
one thing I do you do that thing where you just look for what they're going to do? So if you just were to pinch a toe, they should pull it away. But if they swing,
right,
because they don't actually want to flex their elbow, so they swing it out around.
Or, right, so how do they move? The other thing I do sometimes, and I get it, because when you're trying to get in there, give them vaccines, get other stuff done, you don't always have time, but watch how they sit down and stand up. So like most of the time we don't put our patients on tables because we want to have them on the ground where they can walk. But how do they sit and stand, right? Because if they don't tuck their elbows like a sphinx when they lay down, but they're keeping them out in front, it's because the elbow hurts. If the elbow hurts, it doesn't want to bend. So you don't even have to touch the dog. You just have to watch the dog. And if you watch how they lay down, you're like, oh, you look like a heap of hot garbage, but you're a 3-year-old Labrador. That's not what a Labrador should be doing.
Yeah.
They're telling you, even though they're not verbal.
Why is it important? Because people are going, oh, like one of the biggest things that I have when we teach vet teams is it's so difficult to bring up these topics. If a dog's coming for a vaccine and you go, something going on there, to bring that conversation up is challenging because they haven't come in with that problem. It's a surprise. Why is it important that we do have these conversations?
Because the pet parents may not be aware either. Or the husband brings the dog in, but it's really mom's dog or whatever the family dynamic may be, right? Or they're just not aware, they're busy, but I'll bait them and I'll be like, I'll bending it. I'm like, before I say anything about this, hey, when was the last time your dog went up the stairs or went on a walk? And they're like, yeah, he stopped doing that. He got old.
Yeah.
I'm like, your shepherd is 5. That is not old, right? So you can find out from them and you show them. And oftentimes now for a while, we were curbside with the whole pandemic thing. So it was a little harder, but I would go out to the parking lot, right? And I would ask owners, hey, look, can you bend like this? Cool. You can? Great. Your dog can't. And then once they see that, and they're like, oh, they should be able to bend. Now that makes sense because dogs don't always cry out. They're stoic. They may just lay still and they're like, oh, they're not in pain. No, they're not doing things. So if you find those little steps, right? Or you measure how much muscles they have, right? And if they're atrophied in their muscle and they're thick in that joint, there's the problem. But sometimes it's hard. A big fluffy dog, you don't see it, but your hands are your guide.
Definitely. And just to add why it's important. So like the clients that are following us, the CAM followers, catching it early, you've got more options. Absolutely. You're going to have more stability and functional resilience in that dog to move forward on. If you wait till late, when they're really lame, they're really struggling, they're really in pain, you're going to have lost muscle mass, you're going to have lost function. It's going to be a lot harder to rehab them back to a comfortable life. It might be even impossible by that point.
No, it's not. Because at that point, we may not be able to get as good as we want, but we can still make them better. So I would not say all hope is lost.
I will agree with you on that one.
All right.
But it's a shame when you've got a Labrador that you wish you'd picked up at 18 months to 2 years.
Absolutely.
And you pick it up at 10 years and there's no way those elbows are ever going to go back.
No, but those are things like if we find something like that, it allows you to start a conversation. We could do the same thing with feeling the knees or the hips or the ankles, right? So we can find this. And then we say, you know what, hey, I realize you're busy today, but we ran that annual wellness blood work. So when I get that back, let me talk with you in a few days about that blood work, and maybe I can hop on and we can talk about what I think we feel here. And you know what, in a week or two, why don't you come back? Start with pills. Pills are a good start, right? NSAIDs are a go-to, I think, right? But start with that. But you know what, if we're not getting better, why don't you come back? Let's get a sedated set of radiographs and let me feel it when they're sedate, so I can understand what's going on a little bit more. They're not as going to guard it, but they're still comfortable. And that's way they can lay in really perfect positions, and our vet team can get really good radiographs, and that can give us a ton of info.
Yeah, definitely. Just to recap on the non-steroidals, like the pharmacological intervention, a big fear is once you start, you're on it for life, or once you start, they'll get used to it and it won't be as effective, or all of these. I think, a conversation I have a lot is my intention is to use this now to find what our baseline happiness is. I want to know how comfortable your dog can be. And then we can use other interventions to stay there. We might not need to stay on this medication. And if you lose the weight, adjust the lifestyle, and we introduce a few other things and stop throwing the ball, we can now hopefully come back to this, but without the pharmaceuticals. So anybody that's just been to the vet and their vet has prescribed for them, have this mindset of, yeah, it's necessary at the moment. It's given me the ability to see what my dog could look like and what I aspire to have. But then I'm going to use all these other routes to keep there. That's the plan.
That is exactly the plan, because the NSAIDs can give us kind of as close to instant gratification. We're going to know usually in 4 or 5 days, at least we're getting better.
Yeah.
Here's the other thing too. We can use the pills as a test, because if we don't get better and the pet parents are like, I don't know if I want to take x-rays. I don't know if I want to go see a specialist and get a CAT scan or things like that. Look, if it's fairly straightforward arthritis, in a week, if it's not better on an NSAID, it's not the NSAID's fault.
Yeah.
That pet is now telling you this is not normal. This is not the normal type of disease. Something's really potentially life-threatening if we're talking about bone cancer or joint cancer.
Yeah.
And now we have a strong advocacy to go, let's get our diagnosis correct. Yeah. Let's know what we can deal with.
And that is a big problem. I've actually had 2 cases today where people have been prescribed an anti-inflammatory by one of the team. And they've come back. You say, right, 2 months ago you had this. How do you? Oh, I didn't give it. Okay, yeah. Why? I didn't want to. It's like, okay, why? Because I've heard of bad things. Like, okay, we needed to have that conversation of, let's see what the effect is. This is part of our diagnostic plan. The response to an NSAID tells you so much. Because, okay, bone cancers are one of these many alternative diagnoses, but peripheral neuropathies. So dogs that still continue to drag their toe, walk a little bit wobbly, haven't got that great strength in their back end, and you think, oh, is it pain? I'm going to put them on a non-steroidal, and they carry on being like that, but they're still happy. You're like, well, I'm not sure that this is necessarily pain related.
Well, right, or is it both? Is it's a little bit ortho, it's a little bit neurologic, and which one's dominating? Those old Labradors this time of year, whether it's in the US or it's in the UK, right? Those older Labradors that are scuffing their back feet and are weaker with that peripheral neuropathy. The one I worry about even more, and I know, Hannah, you do too, is what is that dog's breathing like?
Yeah.
Right? So if your dog, or especially we see it the most in Labradors, but a number of other breeds can get it, the same disease that can affect their nerves in their back legs that make them to not know where their feet are can also affect the ability to control their larynx.
Yeah.
And sometimes it sounds like a roaring lion. They're just turbulent to create all this air because their larynx is having trouble moving appropriately to breathe. And in this nasty, dangerous heat and humidity, that can be life-threatening. But the early sign that you may hear in wintertime or spring is that dog who used to have that resilient woof, right, now has a, like, oh, what was that? But that voice change, right? That voice change is one that that's one my nurses are excellent. In primary care or in specialty, my nurses know my diagnosis before I touch the pet.
Yeah.
They're asking the history questions and they know which questions to ask.
Yep.
And they'll come and find me and they're like, they answered yes to these, no to these, and this is the disease. And what we do, we bet cupcakes and milkshakes.
Yeah.
Right? If my nurses are right, I'll buy milkshakes for them anyway.
Hopefully my boss is listening to this.
Right.
We need more of that.
But we interact because I'm like, look, if they're learning, because I was that nurse. I started in vet med, right? I am 43 years old. I started in vet med 29 years ago when I was 14 as a kennel attendant in primary care. Okay. But that's how I got inspired by the vets I worked for, because they would quiz me and grill me and put little tidbits of knowledge in. And that's our job, is to pass that along. So my nurses find it. They're like, we know the x-rays were taken and they found it, it's got bad hips, but trust me, doc, it's got the peripheral neuropathy because its voice sounds like garbage.
Yeah.
You can hear it breathing. And I'm like, you nailed it.
I think it's such a good point that you're making as well, that I had another guy today who's come in and he's tried to lump all of his symptoms into being one disease.
Right.
And therefore it's just like, it's, the Holy Grail, what is it? And unfortunately, comorbidity is really common. So we might have a bit of IBDD, we might have a bit of a peripheral neuropathy, we might have some OA, we've got obesity, we've got other ailments, and everybody tries to lump it. So followers, be open-minded, and also do me a big favor. When you go for a diagnosis, be open to blood sampling, be open to taking a urine sample. Don't go in with the blinkers on. Give your vet every opportunity to find the bigger picture so that it can best manage it for you.
Yeah.
Wise point. Okay, so let's do the stifle, because I think people like the idea. There's going to be loads of people listening now that are just feeling elbows going, oh, this is exciting.
Mm-hmm.
Talk about the stifle. And
so I'm going to do this same way as we do the elbows. Okay. Can't do it visually right now, but everybody reach down. You're sitting. Hopefully you're sitting down. If you're driving, just keep listening, but don't try to grab your own knees. Okay. All right. You shouldn't be on Facebook Live if you're driving. Come on. Right. But reach down and feel your own knees. So keep your feet flat on the floor with your knees bent at a right angle. Okay. And find your own kneecaps.
Yeah.
And on either side of your patella tendons, on either side of your kneecap, your patella, you should again be in concave areas.
Yeah.
Lay your fingers there. If it's not concave, if it's flat or puffy and convex, your knee is full of fluid.
Yeah.
Your knee has a problem. So that's the same thing we start with. And then we do the same things again with the knee. We'll bend the knee all the way. It shouldn't hurt. If it hurts when it bends, it's usually a tear of the meniscus, the shock absorber.
Mm.
And if anybody knows what a meniscal tear feels like, if you haven't had one, I don't wish one on you. But if you've ever had one of those little paper cuts that has that little edge of skin, and you know how you catch it on something and you're like,
ooh. Yeah,
that's a meniscus tear, except you're standing on it.
Yeah,
Right?
nice.
So those, sometimes we hear a click or a clunk, and then we'll extend the knee, just like we extended the elbow, extend the knee all the way out, and just see, are they comfortable? If we go slow, they should get there, right?
Yep.
If we make friends with the pet and do things, because if it's not concave, but if it's thick and puffy and it's painful, especially on extension, that's usually an ACL tear in a dog. That's our most common. Now, the thing is, everybody's like, well, doc, are you going to check for mechanical instability, right? So if this is the tibia, the shin bone, right? And here's the ACL and here's the femur, here's my knee. The job of the ACL is that when my knee plants, and my knee doesn't buckle. When my foot plants, my knee doesn't buckle. When the ACL is torn, that's going to buckle. And we call that a drawer test, like pulling out a drawer, okay? The thing is, we can check for that awake. And if we find it awake, yes, it's torn. But if we're suspicious because it's puffy and it's thick and it's sore, even if it's a little tiny teacup papillon, right? That dog is going to go, nope. And
is that your impression of a teacup chihuahua?
Right? And it still doesn't let us check. And this was cool. I always want to go, where's the research? Not just what comes out of my mouth, but what does research show us? And there was two research papers that showed that dogs that came into a university suspected for an ACL tear, of the dogs, the ones that had no instability awake. So they were like, maybe this is just a partial tear. Maybe it's not really a tear. Maybe it's just a little bit of arthritis. What they did was they sedated very safely all those dogs with the anesthesia team. And they got x-rays to look for swelling, arthritis, and things like that. But what they also did was they felt every one of those knees again when the dog was asleep.
Yeah.
Hannah, 50% of the dogs that did not have instability awake, half of them had complete tears once they were unconscious.
Yeah.
So
muscle
guarding, capsule guarding, right? So we as a vet team, sometimes that sedated exam is not only for the x-rays, it's for us to get a better feeling, to know we're right and how to best help that pet.
Definitely. Right? I think there is definitely a wish that you have the ability to detect exactly what's wrong with that dog the moment it walks in and have all the answers. And I think, you can be the best vet in the world. We do need to have the opportunity to do the further investigations to get you the best answers. But I am going to do a little yellow card for anybody here that is not insured, limited finances, And they've got their grandmothers with them, they've got kids going to school, the fuel prices here are going through the roof, and they're listening, trying to get advice, and they're now scared to go to the vet because they might not afford it. Don't be, because we can still do a lot without doing sedation, x-rays, etc. We're giving you the best possible. Sure. But if somebody came to me and said, like, I think my dog's not very well, their mobility is really poor, but I'm on really limited income, I could still do a world of good for you. So do not use that as a reason not to go, is what I'm trying to say.
Absolutely.
Okay. So now we're going to, having given people that kind of belief and understanding that we can get a lot from palpation, from observation, and we like to confirm it with diagnostic imaging, which might be x-rays, CT, etc. Let's talk about some of these rehab options, because over here in the UK is a massive tendency for non-steroidals and supplements, and that is it. It's all in the mouth. I get really frustrated because there is so much more out there. Tell us about your most simple, cost-effective, but mind-blowing case, and then blow our marbles with some outrageous stuff that you do.
Fair enough. Look, here's the first and foremost. Nothing beats going for a walk and being lean. Okay. And if you're like, well, how lean does my dog have to be? Okay. Everybody sees my, oops, where am I going? That way, right? This is what your dog's ribs should feel like. If you rub your finger over your dog's ribs, you should feel like this. If you can't feel that, if you're pushing through 3 inches or 6 centimeters of padding, it's too much. Okay. And food can be love, but we can also do too much of a good thing, because if they're fat, they put more weight on their body, more weight on their joints. And you're like, okay, fine, but my dog is not walking all the time. It's sleeping a lot. So the fat doesn't impact it because the fat's not pulling it down when it's sleeping. That is true. But fat at a microscopic level triggers the body with these little things called adipokines that actually eat away cartilage 24/7, 365.
That's pretty awful, isn't it?
And that's in people too. Okay.
And that's the hardest conversation, is when somebody turns around and goes, hey, gonna help me with me as well? And you're like, oh gosh.
But where's the research? So the research shows that in people, if we're leaner, we don't need joint replacements. We don't need pills. In dogs, less body fat, less pills.
Yeah.
Also, more life. There was a study, 50,000 dogs in a research study, huge, astronomically huge study group. And they broke it down by breed and by sex of the dogs and said, are you male, female, neutered, not neutered? What breed are you, and how long do you live? And are you fat or are you not? And Hannah, right? Dachshunds. Dachshunds, one of my favorite breeds of all time. Okay. Happy little wiener dogs, right? Everybody loves them.
You can't say wiener in the UK.
Just did.
But anyway.
If in that study, those dachshunds, if they were fat, they lived almost 2.5 years less than their lean dogs. So the lean ones live 2.5 years more. Okay. Golden retriever.
And people are so massive.
Look at the pun about gravity and being fat. She calls it massive. Puns on
I like it. No, I was talking to a few colleagues that I qualified with 20 years as well. And one of them, my friend Gail Halliwell, she has got more initials than you have. She's got more post-nominals than even you have. And I was saying to her, I love my weight clinics. I bloody love it, because it's an instant win. Once they start losing the weight, the owners are happier, the dog's happier, you're happy. It's so good getting the weight off these pets. But sadly, here in the UK, it's becoming a taboo subject. Vets don't talk about it because it's going to be difficult. They're not going to take it very well. They're going to be offended. They're going to brush it off. I haven't got enough time. But actually, it's just game changing when you get their weight off.
Well, and but the thing is like, look, I'll be honest. I'm not here to make every pet owner happy. No. I'm going to tell you the truth. And the oath that I take, I think, Hannah, the oath that you guys take in the UK is very similar. We are here as the advocate for the pet.
Yeah.
It doesn't matter if it's truth. We have to tell the truth. We're going to tell you what's going to be the best option. So
Yeah.
we do that. And we can go, look, let's get weight off. Let's bring in an underwater treadmill with our hydrotherapy teams and get those dogs. Okay, you know what? If mom and dad can't walk, or it's too hot out, or whatever else, fine. Bring them in. We can put them in the underwater treadmill, and now they can walk when the water's up at the level of their hip. They're only going to feel like they weigh about a third of their body weight, maybe half.
Yeah.
And so now that dog can really walk for 15, 20 minutes and start to get some calorie burn. Yeah. And we've got research to back that up too. So I start simple. Get lean, feed less food, make sure we're doing our calorie counting appropriately and not starving them, right? And get exercise.
And I think that calorie count thing is another good thing. Okay, so one of the nurses today, I got her to actually do a calorie count for the target weight. So the owner was like, oh, I'm on this diet. I'm feeding 200 grams. I'm there. So we actually did the quick equation, 30 times target body weight plus 70. And we looked at what the bag calorie count per kilo was. And we worked it out that she was still feeding over, I think it was another 100 calories a day over what she should have done. Yeah. And it was a real shock to her because she'd followed the bag guidelines. And the bag guidelines are going to be wide, guys. They're going to be wide. So do they're
going to be wide. And then what gets us a lot in the US and Hannah, let's see where it is in the UK, is the guidelines on the back of the bag are designed for dogs that have their sexual organs.
Yeah.
And the day we castrate them or spay them, their caloric requirements drop by 25 to 33%.
Yeah.
Okay. So if we have to just be aware of that, if we don't post that, it's not that the dog food companies are out there trying to sell more food. You just have to know what the rules are.
Yeah.
And if your dog doesn't have testicles, right? Well, then let's feed them less because they're not putting any energy towards those things.
No. And I've definitely found as a clinician, as soon as I start getting a piece of paper out and I do a bit of a calculation and I have figures, it becomes important. And I'm not speculating, I'm being accurate. And they kind of go, all right. And then I'm eviler because I'll say, right, this is our target weight. We're going to do 1% per week. That means that you've got to lose 4% this month. This is a 3-month project. This is where we're going. And they're like, right, okay, she's not showing me. She means this.
You've been the advocate. You have the knowledge. You implore it, and we can get things accomplished. And those are fun because we don't want to see them all the time. If they're right, we want to help them get them feel better, but go out and enjoy life.
Yeah.
So I look at that. That's our simple steps. I love what now we used to call laser therapy, but lasers, it's like, is it a laser for arthritis or is it a Dr. Evil laser and Austin Powers, right?
Yeah.
So what the term that we want to really use in the vet rehab world is what's called photoceuticals, right? Because
I've not heard that one.
I love bringing a new little bit.
Oh my God, you Americans, you have to add a label to everything. Okay, bring on. Let's hear more about it.
Because photo is light.
Yeah.
And ceutical, just like a pharmaceutical, we're prescribing a very specific thing for a very specific purpose.
We're going to use that.
We're using a photoceutical approach to prescribe laser therapy appropriately for arthritis.
Yeah.
And we can do that in the clinic, in the vet hospital with the nurses and the team. Yeah. And now there's even research and good evidence that we can use certain photoceutical devices at home, that pet parents can be this, and not the ones in the back of a online thing that is going to magically regrow some bald man's hair.
Yeah. Okay?
But an actual device that has been studied in dogs and in other animals specifically for arthritis. And so you can
wait a minute. So tell us about this. There's and obviously, if you want to say the company name, that's fine. And if there's clinical evidence, that's allowed on CAN. If it's speculative, no. But I assume you're now talking about LED devices.
We are talking about class 1 medical at-home devices. Okay.
We will talk about this more.
We will talk about this more. I will see you. I will be over in Cambridge in 4 short weeks.
Yes.
You and I are both at the International Vet Rehab.
Oh, please tell people about this. Yeah.
Can I plug that, right?
Yeah, go plug it.
We're going to have a blast. We had a little bit of a snag, thanks COVID. We were supposed to be there in 2020, but we reorganized it so we can be in person. We've done some virtual events, but we will be there in Cambridge, right at the university, the week of August 15th.
Yep.
For all you folks that are in the vet field, you can go to IAVRPT2022.com, the International Academy of Veterinary Rehab and Physical Therapy, and you can come and learn from the best in the world.
Yes.
Last meeting, we represented 6 continents. Couldn't get anybody from Antarctica to show up, and we had 99 countries represented.
Yeah.
So veterinary animal rehab professionals from around the globe with the latest research for both dogs and cats and horses, and how to figure out what is our best knowledge base for all of this. And so with those types of things, we can do that. And you and I will then talk more about at-home photoceuticals.
Yeah. And I'm just going to do a little plug because we're very lucky. Cam has been invited to do a breakfast lecture teaching all the students that are attending about what we've learned from you guys with all the CAM events that we've done over the last 6 years. So all the things that you do and you tell me and you email me and you put on Holly's Army and you put on the thread is coming together in a lecture that's going to be going out to people around the world of what has Cam learnt from the followers that you guys need to know to help you help others. So it's really cool.
It's going to be a fun time. So we're going to take that stuff so we can use, here's my point, right? If it's 1 elbow or 2 elbows, or even if it's 2 elbows and 2 bad hips, right? There's a common thing that we all see, right? Why are we still fighting the whole patient?
Yeah.
Why are we stuffing in the pills? Lose weight, walk more, targeted approaches. So external targeted approaches is photoceuticals. We can put the device right on here. We could use an electromagnetic field device at home. We can do massage and other things that there's some fantastic people out there that can do that. Like Diane Meeson's been on with you, Hannah. Kirsty Oliver's been on. All those people that are complete, absolute gems to making things move better. My job is to find it and make it feel better quick. Their job is to really manage it, and they do an exceptional job with that.
Yeah, yeah.
So I look at those, but then I go, well, what if those aren't working? Or what if those aren't an option? Or what else can we do? But I still want a targeted approach.
Yeah.
And sometimes that's surgery. And there's a bunch of fantastic people all across the globe that can do some amazing surgeries to either repair ACL tears, or we can even replace hips or knees or elbows or even shoulders, right? We can put in bionic implants. Noel Fitzpatrick, Jonathan Dice, Denis Marcel and Little, just as a handful of people around the globe who are phenomenal joint replacement surgeons, okay?
Yep.
That allows us to cure that. But maybe that's not for everybody. But how can we do a better job of targeted management? That's what I get to do a bunch. So if I have an arthritic elbow, right? People have this too. You'll put a needle in, you'll take the fluid out. But if I just take the fluid out, then it comes right back. But if I put into that joint a targeted anti-inflammatory, oftentimes now we can get them off the pills.
Yeah.
Okay?
So tell them. Let's do intra-articular, because I think over here in the UK there's a real lack of confidence towards it, a lack of awareness. I think for a first opinion practitioner, there's a fear component, and I think the fear component definitely comes from the fact of this is more expensive than the pills, and what happens if it doesn't work? That owner's going to lose faith in me. So let's just talk about intra-articular, because you do it every single day.
I do it probably per week. I'm probably injecting 15 patients per week, every week, week on, week off.
Yeah.
So I have a very, very, very busy caseload, because the same thing in the US, where the primary cares don't feel empowered to do this.
Yeah.
And I'll be honest, I think that is something both in the UK, in the US, and around the world, that the vet schools need to do a better job of advocating and teaching their students how to find arthritis and how to manage it.
Yeah.
But you can learn that through the CCAT programs, through the CAM programs and things like that anyway. So we still got you covered, okay?
Yes.
But we can inject, because sometimes we'll take the fluid out and we want to send it to the laboratory and go, is it cancer? Is it infection? Is it an autoimmune disease? But if you've already done that, right? You pulled up to the petrol station and you can pull fluid out. Well, why can't you just put in petrol and put something else in there? You're already there.
Yeah.
We could put in cortisone and synthetic joint fluid. There's some new joint viscosity things to help improve, just like you get, well, Hannah doesn't need it because her skin's perfect. But if you have that really nice, those skin creams, right? To keep your skin nice and lubricated. You can take stuff like that and inject that into a joint, and you'll get better movement of the joint. So we may take cortisone and synthetic joint fluid to do that with a dog or even a cat, okay? And those are very helpful. We've learned that a lot from human medicine and from our colleagues that work on horses, that they've injected joints for decades. Mm-hmm. But what I think is much more biologically friendly, more cutting edge, and stronger in its efficacy are things like platelet-rich plasma, or PRP, where we take some of their own blood and we get rid of the red blood cells, most of the white blood cells, and the platelets trigger they're the Captain America to the red skull that is the fat cells. The fat cells are out there trying to destroy all the cartilage, and in comes, right? The PRP triggers that. So if you dump a bunch of platelets right into the joint, it will make that joint feel better because it calms it down.
And how long does that last? So over here, I think people are beginning to hear about stuff. Like we've got the inerts, and then we've got the more kind of biologicals. Yeah. But I think definitely a lot of first opinion practitioners are again in fear of, I'm going to go to quite an expense. I'm going to put PRP in this joint, and I don't know if it's going to work, how long it will last for, how often do I top up?
We're still learning that. They'll last about 3 months for the cortisones, maybe 6 months or so for the PRP, depending on what's going on. And the key with that one is look, we're not out. It's not like we're not growing it to grow a brand new joint, right? It's not like magic little stem cells or even we use stem cells. It's not out there to regenerate a completely normal joint. It's there to make the joint feel better for X amount of time while we get the whole pet moving.
Yeah.
So if it's
the same as using the pharmaceutical, isn't it? It's the same as this is a window of opportunity.
Exactly. But it's a targeted approach with virtually no side effects, right? Other than it may not work, depending on what we're using, right? Or how's everybody going to respond? And requires a minor risk of light sedation, right? Because we don't want to inject joints awake. That's just not right. Okay. Right. So we're going to do that. And those are good. And we get a chance to start getting weight off, moving the dog better, all those helpful little things, get him into our rehab team and following up with hydrotherapy and things like that.
Yeah.
But then what's really fun, so that was been our go-to for a while, was PRP, combining it with synthetic joint fluid, even using, sometimes we were doing stem cells, but the stem cell research was like, look, it may cost a lot more than PRP. It may not last, it's not a big, long time. And a lot of the hard part is vet med, we always need more research. We need more research time. But studies, are tough because we don't, much like Cam does, you don't want to take a bunch of money from some sponsor and then have to do something. Mm-hmm. Sometimes our research studies are only maybe 6 months long.
Yeah.
Right? But
that's the big thing, isn't it? Longevity studies. I think the public need to know this. There's more material that's coming out now about these different interventions, but they're always very short. And you might be lucky to get a 365-day study, but you're going to really struggle to get one.
Well, that's the interesting thing. So up until 2 years ago in the canine world, there was no study that had ever gotten to 365 days. Mm. So we're like, all right, this is the best we got. And we're working on it. We keep learning and we keep helping stuff. And let's see. But then what came across my desk 2 years ago was research in dogs for a full 12 months for injectable therapy into elbows in dogs. Done.
What would that be there, Matt?
So that was at 2 universities and a big practice here in the States in Texas. And that was a product called Synovitin OA.
Yeah.
Okay. And this is really cool because this is what we did most of the time in vet med. We use something and then human medicine goes, hey, that's pretty good. Let's use it on people. This is the backward.
Yeah.
This type of technology has been used in Europe, in Germany, in France, right? In people for 20 to 30 years. And now it got brought to the US to be looked at in dogs. And now we're looking at it in cats as well and things like that. But it's using what's called radiosynovioarthritis, which is a giant word, okay? What we're doing is we get to inject this stuff directly into the joint, and it essentially, like I need a good shave now, it shaves back all that excessive joint capsule that's all thickened and aggravated. And that joint capsule that's really thickened and aggravated just makes a more uncomfortable arthritic joint. So if we shave that back, it's nice and smooth, and now that joint can glide better, and we're not triggering off the nerve endings.
Yeah, and it's sad because I heard about this years and years ago, and I can remember lecturing when I was a bit of a wild child, just going, everybody needs to know more. And I was like total wild card. And I was saying, do you not realize we have got radioactive materials that we now inject into joints? And vets were looking at me going, shut up, just shut up. But sadly, I don't think we're ever going to get it in this country because
we will see.
Because isn't it a medical device over in the US? It's not.
It's a medical device. It's not a drug. Okay.
Yeah.
So it's an isotope of tin, like Wizard of Oz, Tin Man, right?
Yeah.
But it doesn't. It is radioactive, right? Sure, but so are things like if you go and get a cardiac stress test, you get an injectable radioisotope so that we can see how your heart's beating.
Yeah.
Right? So it's a very safe, very well studied device. We're not causing harm, and we have those studies in dogs that we show it doesn't cause harm, and we have studies that show that it benefits them.
Yeah.
And it's something that can last. It only stays in the joint for about 3 months.
Yeah.
But the duration of action is 12 months.
Yeah.
So
have you got licensed now for hips? It was elbows only, wasn't it?
It's elbows only. That's where the original studies were. Now they're doing studies at the University of Pennsylvania's vet school looking at dogs' hips. And our resident here at our hospital, we're launching an ankle, a tarsal OA study in dogs just next month. Okay. Yeah. So we're looking at other areas, but the license was adjusted because I've done enough cases where I've sat with the Department of Health and things, and I can now inject it into any species in any joint that has arthritis that meets certain criteria. Amazing. So I've injected it into 2 cats because they had no other options left and the owners were considering euthanasia.
Yeah.
And those cats are now comfortable. Okay.
Wow.
So that's a huge step. Those cats are alive. They're happy with their families. I've injected into almost 75 or 80 elbow patients. A couple of ankles are ready just as test subjects, and I'm happy with the results. And I'm tracking everything right, with my resident and my vet student and all my project cases. And we're going to publish our research no matter what it is. And we're going to show this is what we found. But it is become my go-to. And I do hope, I have no insider info at all, okay? But I want something like this to be available around the globe.
Yeah, definitely. Right? Okay, so it's your go-to. It was your go-to just for elbows, but now because of your position that you're in, you're actually really seeing it as like a first-line targeted approach for other joints as well.
I think it could be. I want to learn more. It's not going to replace fixing a torn ACL. If they have giant mechanical instability, we need to do things that can repair that mechanical.
Shoulder's very soft tissue.
Shoulder's very soft tissue, and we don't have a clinical study yet. So I'm going to take the slight high road as a specialist and go. We'll take that on a case by case basis. Okay.
Yeah.
So we'll be careful with those, and we'll use them in cases. But what I can also see is it's not just using it in the old dogs where we have nothing left, but when my surgeons go in and they clean out a joint in an elbow dysplasia case in a 1-year-old dog, but there's no cartilage left and the joint capsule is really thick and aggravated, they'll say, hey, let it heal for about 3 months and then go see Dr. Brunke. And if that elbow still hurts and that 1-year-old, 2-year-old dog is still taking pills every day, it's time to inject this stuff now.
So essentially, that's a really good thing. Arthroscopy. Over there, are people doing arthroscopy on elbows and placing something before they leave? Because over here, it's not so common. We're still going in, flushing, removing fragments, closing.
We're still doing that too. We're doing it arthroscopically. So we have the saline flushing through all the time, and then we'll get those out. But the thing is that if there's cracks and divots, that just removing the pebbles, we used to say it was like having a pebble in your shoe. Removing the pebble alone now doesn't solve it because you still have a callus or a blister of that cartilage or an aggravation of that joint capsule, that's synovitis. Right? Yeah. And if that doesn't get calmed down by mechanics. That gets calmed down by putting in something into that joint or trying to get that joint capsule to calm down. And it's not just like say, hey, you go sit in a corner and think about what you did wrong. Okay.
Yeah.
Like we have to put something in there that makes it a healthier environment.
Yeah.
So that's where we can change the oil in our car when it runs out.
Yeah.
Or we have to change the oil in the joint because the joint capsule is what makes that good joint fluid. So if we can make that better, now we can get there. Right. So I like to use it in my younger animals because now I have a chance that, hey, maybe they don't have to be on those NSAIDs and those pills for their whole life or half their life.
Yeah.
Maybe they take it just once in a while. That's okay. I'm not out to cure it. We're out to just get the best management possible.
Yeah, that's a really big take home for everybody, is that everything bar joint surgery replacement is not curative. It's about getting it into the best possible state for the most comfortable, longest life. But even, I love this, Karen Perry Butler was like, I wish people would stop saying joint replacement surgery is a cure for arthritis, because most of these dogs have it elsewhere. So stop lying. I was like, that's very true.
It's for that joint, and but if it's our best way to be biomechanically even better than what that dog had before, that to me is a huge help. But yes, we still have to think about the patient as a whole. We're not going to go in and replace 12 joints.
No, exactly. Okay, because we're running out of time, we're going to answer a couple of questions. I'm probably going to put you on the spot.
Of course.
And if you've got any interest, you declare them now. So we have Cartrafen over here in the UK. So I'm on call. I'm on coffee. This is very boring.
I'm not. I'm done for the day.
It's not fair. Right. So over here we have Cartrafen. So sodium pentosan sulfate, whereas you have Adequan.
Correct.
Which is different.
Yeah, slightly different. So I don't have any firsthand clinical experience with Cartrafen. You would, Hannah, the UK, Canada, and Australia do.
Yes.
But similarly to what's called Adequan by trade name, what happens is if you were to think about what cartilage is made out of, it's made out of something that's kind of like a lattice frame. Like if you're making a pie and you have all these overlapping lines that are trying to support the joint. That's called ECM, or extracellular matrix. And that's a big term, but the thing is you have to have those building blocks for healthy joints. And when you have damaged joints, those things rub away and fall away. So Cartrafen and Adequan and polysulfated, they're the building blocks. So in horses, we'll inject those directly into joints.
Yeah.
In people, interestingly enough, because our joints are different, it doesn't really help us. No. So that's why we don't use it in people. Okay. But it's nice because in dogs, we can give it under the skin and it goes and it finds its way into all the problematic joints and fills in the gaps.
Yeah.
It's a helpful piece. And I think it's a very important piece. It's just that it's not what I would consider a standalone. It's not.
I was going to say that too.
Okay.
Yeah. I think over here,
problems, but it's a good team player.
It's a team player. I think the Cartrafen studies over here, they're very small. They're like 16 to 30 dogs.
Yeah.
So the data is a little bit weak and they're not long-term studies.
No.
And they're quite old studies.
Right. But there is an old one. And now granted, it's not showing that it improves cats, but they actually showed that it will get into cats' joint fluid if you give it under the skin. Because at least in the US, it's only on label to put it right into the muscle, which can sting a little bit.
Yeah.
But if we teach pet owners how to give insulin to their pets, if they're diabetic, they give it under the skin at home. They don't come into the clinic every day.
No.
What I like about Cartrafen, from what I've heard from my colleagues that use it, and with the Adequan, is we can give it under the skin and it still gets there, which means we can teach pet parents how to do that, which then saves.
I don't think it's going to happen. Yeah, it won't
happen in the UK, but that's what we do in the US. And that's what allowed me, when I was in primary care, I did that for all my cat patients so that we were much calmer. The cats didn't have to come in.
Yeah, no, that would be good.
So that is my favorite for cats.
I think here in the UK, if I was to give somebody advice, I'd say, yeah, if you can afford it, brilliant, try it. Do not fall into the trap of using it monthly. Use it once a week for 4 consecutive weeks like it is licensed. Objectively monitor before and objectively monitor after. but also bear in mind that it's a regression to the mean disease. 4 weeks is a brilliant amount of time for the dog to stabilize anyway. So have your wits around you.
Right. But what you have that I'm going to spin this back onto you now is, because I don't have it here yet, is you have I know.
Oh, yeah.
You have the Silencia and stuff like that, the monoclonal antibodies that are once a month injections for cats and dogs.
Yeah.
Now, the FDA here in the States has approved it for cats, but we're not going to get it to use it until about Christmas time, hopefully sooner. Stuff happens. Okay. But what's your experience with that, Hannah? Because that's what I'm always intrigued about.
Yeah. Very, very quickly, Caroline. Every practice that I've worked in, we tend to use it as a way to monitor the dog's improvement as well. So it's not any kind of secret thing. It's, are we actually seeing improvement? Because many of these dogs that come in are in significant pain. So using it, we want them to come back so we can improve that it's working. Because if it's not working, we need to do something else.
Well, if I can chime in on that one, what I did was I would give it to the pet parents to do for the first month, because it may take a month to see, and then they come back and recheck with us, and we see, and if it's working, now we may continue to do it at home. So it's not like I just give it to them for a year and say goodbye. We see if it works. But yes, but what's your experience with
Silencia?
Yeah, Silencia, because what it really, I'll give the quick version of what it does, and you can tell me how you thought it worked, is the joint cap cartilage doesn't have nerve endings, but the joint capsule does. And when you're having an arthritic joint, all the nerve endings come together and just blast a big message of pain up to the brain. And Silencia silences that nerve ending because it calms down. It doesn't allow the body to build up all those painful nerve endings. So what did you see with it, Hannah?
We've had really good results. I'm going to definitely say now there's a couple of reservations I have, is that I'm seeing people becoming unimodal therapists again, which I think is bad. So people are going, here's Librela, but they don't talk about weight. They don't talk about lifestyle. They don't talk about controlled exercise and targeted exercise. And I think that's sad, because any intervention needs to have a multimodal approach. So on that sense, the next thing that's a little concerning about it is a lot of dogs feel better before their body is better. And they're going out, and they've now actually written this into the SPC. Please discourage dogs from overdoing it before they are rehabilitated. So your dog's brain's going to go, whoa, yeah, good. And then the body goes, oh no, I'm not ready yet. So that's a little concern. We've definitely seen quite a few cases that get PUPD. So they were polydipsic and polyuria. Yeah. And there isn't any effect on the kidney. So many of these have had kidney functional tests. And once you come off the Librela, it seems to stop. And I've also had an owner recently that when the benefits I'm seeing outweigh my dog drinking and peeing more, I want to do it again. So they've done another injection, and actually the PUPD subsided. So whether it's a transient thing in a select few, I think, like all interventions, it needs to be monitored. I've had some cases that haven't responded to it, but that's because we've got a more complex diagnosis. We've got comorbidities to consider, etc. But so far, it's really it's a lovely thing to have in our toolbox. It really, really is. So yeah. Okay, my next question. I think this lady is brilliant, Hannah Hancock. Absolutely, it makes logical sense considering that a large portion of pets are neutered to have both. Good thinking, Hannah. I love your brain. I'm going to throw out there, because you have a different situation with CBD over there, don't you?
Ooh, yeah, that's an entertaining. Well, we could talk for a whole hour or two on that.
Yeah.
To my knowledge, right now, so CBDs are like, they're not regulated in the U.S. So they're like joint supplements. You could have stuff in them. We don't know. There's not a regulatory aspect to it. To my knowledge, at least right now, and I don't keep up on all the CBD research, but there is one brand of canine-specific CBD supplementation that has been studied for dogs with arthritis. There are 50,000 brands on the market. There is one with any research to back it, and they are all different. So we don't know yet. It's still the Wild West with that. Ask for research. Hey, and is it dosed? Because much like sometimes with like omega-3 fatty acids, You can dose it for skin problems or kidney problems or arthritis. All the doses are all over the place. So when it says like it's 1 pill once a day, is that for skin or is that for arthritis? And the same thing I ask of CBDs. Are you using it for anxiety, or are you using it for pain, or are you using it for arthritis? Or now they're starting to study it for seizure control. But we need to know more. So you have to ask the companies for their research and what are they specifically dosing it for.
Yeah, and I think quite often I ask owners to bring in the packet materials because, as you said, one CBD is very different to another. And as soon as the packet says proprietary recipe or something like that, you're like, nah, no. If you're not going to declare what's in there, this is...
I'll send a link. If anybody really wants it, Hannah, I'll send it to you. You can post it up. There was an article done by one of my mentors. So Joseph Washleg is... he's
a god.
Just look. Love him, right? But he's a PhD in pharmacology, a veterinarian, a nutrition specialist, a sled dog musher, and a sports medicine specialist.
Oh my God.
He's a little bit of an overachiever. Hi, Joe. Okay. He put out an independent study of 17 different CBD supplements. He took them all, ground them up individually, and fed them through a chemistry lab and said, do you even have what you're supposed to have in you?
Yeah.
2 of the 17 had anything of value in it.
It's disgusting, isn't it?
Some of them had toxic levels of THC in them. That were dangerous for the dogs. So I will send that. That's an open article. I will send that to you, Hannah.
Please.
Put that up for everybody to read, okay?
Yeah, please do. Because I think definitely something that you feel, like I've been running CAM for 8 years now, is that there's a bit of a them and us. You know, the supplement people are good people and the pharmaceuticals and vets are bad people. And it's so not like that at all. At the end of the day, there are 2 cohorts that are making money, you know, be it the vets, be it the supplements. So don't do the good guy, bad guy thing. But I am concerned about the amount of people that feel that they have to go alone on it. So they start buying things off eBay, they buy it off Amazon, they don't tell their vet because they don't want to be told off. Just so you all know, here in the UK, vets have to follow the prescribing cascade.
Yep.
And that means, sadly, CBD isn't the first thing that we would prescribe. It's the sort of thing that we would, at the end of trying different things, we feel that we can at that point say, right, now we can introduce CBD. And some people don't like it, but that's just the rules and regulations that we have. So yes, please be respectful for your vet. They're not trying to be difficult. Yep. Thanks, dude. I think that's all the questions. I'm really aware that you said, are we talking for half an hour? And I went, no, an hour.
No, I don't know.
No, it's been really, really, really cool. What would be a take home? Give the lovely people and everybody that's watching, please say hello, Matt. You are amazing. And thank you for spending time, because it is so good that he's given us his time and his knowledge. Give us a take home that people can walk away with and go, yeah. You
can help your vets find arthritis, because what I'm going to ask everybody to do tonight, okay, in the next couple of days, is get down on the floor with your pet and pet them, right? Spend time with them. That's why you have them in your lives. And I want you all very carefully and gently to bend your dog's elbows. And if they don't bend all the way, if their wrist and their toes doesn't come up near their shoulder, right? And they stop like this and they start to shake, I want you to go see your vet. I want you to say, hey, I was listening to Cam and Dr. Capon and Dr. Brunke gave me some pointers, and I think my dog has elbow arthritis. Yeah. I want you to look for it. So I want to empower everybody that's watching to be a good advocate, to help our vet team to figure those out a little bit more. Because if you're aware, you can feel it. You all did it today. You can go do that to your pets tonight or tomorrow. Why don't you do that? And then be good advocates. We're behind the 8 ball, but we can be proactive as much as we can instead of reactive, and then see what we can treat with. And go take your dog for a walk. Take your dog for a walk. I love it. Thank you, Matt. It's an utter pleasure. And I'll see you in 4 weeks? 4 weeks, dear. All right. Right. See you later, guys. Take care, everybody.